Kim currently has a private practice focused on emotional and intimacy therapy in the Kansas City area, healing like wildflowers. In addition to her therapy practice, Kim has lectured to medical students and professionals, providing local and national talks related to sexual and gender topics. She also created and hosted annually for 9 years, a sexuality conference at the University of Kansas School of Medicine to bolster the education of students. And we're very happy to have Kim here with us. And I'll let you take it away and start sharing your screen, Kim.
Okay. Do I need to share the screen or I'm with you now, right? You can see me?
Yes, you're with us now. So if you have
Perfect.
anything you want them to see, then share your screen, however you want to do it. Take it away.
All right, fabulous. Well, thank you for the introduction, Terry. And thank you all for taking time this afternoon to be here. Anytime I talk to folks in the community about sexuality, I always want to start kind of setting up a dynamic for us. So if I sit here and I talk at you about sexuality, the chance that I actually meet your needs and know what your questions are and attend to why you are here with me today is really low. I really want this to be an exchange so that when you walk out of here, when you roll out of here, when you lay down, take your nap after we're done today, whatever it is, that you feel like the reason you were here was really addressed. Okay, I want us to be a partnership. So the analogy that always goes through my head with this, it's kind of like a sexual exchange. Like if I walked into a sexual exchange with just my agenda and I never paid attention to my husband, then we are not both satisfied at the end of that scenario. And that's how I feel about y'all. Like I need to hear from you so that I can attend to you in a way that really makes sense for you today. Okay, I hope that resonates and you're really able to hear that. I was telling Sherry previously that my experience with ALS is very limited. So the closest in my own personal life that I've gotten to where we need to talk about today is my previous husband did pass away from cancer. So we went through extensive cancer treatments for 8 years, and our roles changed. I became his caretaker. We did the whole thing. So that's where my heart is going to come from today, and where my empathy is going to come from today as we have this conversation. But if you feel and you hear some level of ignorance around ALS specifically, speak up about that too. Type it out to Sherry, say, tell Kim to pause for a second on this one. She needs to hear this differently or whatever the case may be, because I am very open to your experience. Okay, so with that being said, when I think about how really, really significant medical diagnoses impacts things like sexuality, I'm going to start throwing out at you some of the things that go through my mind. And if you want to just use the chat room to throw some ideas out there too, if you want to send some ideas to Sherry through email, you can do that as well. But right away, when I think about symptoms associated with ALS, I think about things like fatigue. And how does fatigue impact our intimacies and our erotic lives? Or changes in muscle functioning, right? And when we're weak, sexuality takes some energy, takes some effort, takes some physical effort. And so if we feel that weakness, it might feel like a big barrier to something like pleasure. I think about fear. Again, if I reflect back on my own experience with my husband, with his original diagnosis, it was really interesting because the fear that I felt as his partner about losing him made me shut down my own sexuality. I hit the mute button really fast on that. And then interestingly enough, as his illness progressed, I had the opposite reaction. Then I just wanted to touch him and love him and be as close and connected to him as I possibly could in those last parts of his life. So it went in a really dynamic way from one extreme to the other. The other thing, of course, that goes to my mind is that role of caretaker. So we went from being partnered and co-parents and all the things to all of a sudden, I mean, there were very sincere moments for my husband when he was so sick. His treatment made him feel awful. The medications, I joke that Lord Voldemort from Harry Potter must have been mixing up his cancer treatment somewhere because it was so hard on him. So all of a sudden we went from, gosh, my guy who'd go on a 40-mile bike ride with me one weekend to the man who literally I was, cleaning up his feces and things when he couldn't make it to the bathroom. So that started to feel emotionally more like I was a parent to him instead of a lover to him. And there's a thing in our brain that says when we are taking care of children, that's not a place we can be erotically, right? So that becomes a tremendous barrier for us. Um, if you start to look, and I noticed somebody talked about like physically, but what if we can't even move? And I'm going to talk to you in just a few minutes about the thought process that we might use to be able to really access pleasure, even when our bodies aren't moving the way that we want them to. So hold on, I'm going to try to get there for us.
Good. A couple questions about that, Kim. So perfect.
Good, good. The other thing that I think is psychologically really, really vital, there are a couple things. Like one thing is when we can't trust our own body and our own body's functioning, that becomes a really big barrier, right? When we think about sexuality, we are literally at times inviting our partner into our being, or we are entering our partner's, body with a body that we may no longer trust. So that gets really hairy psychologically. And then I feel like was another, oh, just that sense of self. Like when we no longer like actually know who we are, but we're trying to share ourselves with our partner, that's quite the mountain to climb. There is research about cancer diagnosis, post-stroke, MS, which gets pretty close to that ALS stuff. And what's interesting is regardless of even prognosis, we see 100% of people who have these big medical diagnoses have really dramatic impacts to their sexual health. Even someone, let's say somebody has a cancer diagnosis like a melanoma, and they're going to have a mole removed, and now they're melanoma free, cancer free. Just the act of having that diagnosis and no longer being able to trust that your body is there to protect you changes our sexual experience dramatically. It makes it just plummet really quickly. Okay. So again, I'm open to your feedback and I'm with you on this. I'm trying to really hear you. So if there are things that you want to be discussing, or if I miss some really important points, some barriers that we need to navigate around intimacy, please let me know. So what I thought we would do today to try to make this be really helpful is let you know of the barriers that I was able to identify on my own. I'd like to talk you through, if you're a client, if you came into my office, what are some of the tools and strategies, the concrete things that we might do to try to navigate that, okay? So one thing that I really like to do, let me show you, I'm going to screen share with you. I'm going to show you a worksheet that I really like with clients. So this worksheet comes from, it's called Turning Off the Offs, and it comes from Emily Nagoski's work. So Emily Nagoski wrote this really beautiful book called Come As You Are. And with that, there's a workbook you can go through and stuff, but these worksheets are available online. So they're very accessible. But my favorite part of these worksheets that I use constantly with folks is number 3 right here. And what you see is this question: what is the biggest obstacle to the goal? So let's just use one of the obstacles, and we can use many of them, but we're going to start with one. So if we just think about fatigue, let's say fatigue today is the biggest obstacle to the goal of intimacy. Well, that next question, where and when specifically does this obstacle occur? Now, I like that question a lot because all of a sudden we have some bookends. around fatigue. So what we might find is that fatigue gets worse throughout the day. Or maybe you're the opposite. Maybe you wake up just really groggy and it takes you a long time to get going. But in the middle of the day, there's a little more energy and then it tapers off again. I mean, I don't know what your specific story is, but the idea of really starting to think about when and where specifically is obstacle a complete barrier to intimacy, then all of a sudden we define it a little bit more narrowly instead of having it feel like it's just constant fatigue. Okay. Then that next question, what can I do to prevent this obstacle? So that might be, and I'm just going to make up a possibility since we're not talking back and forth. And again, I encourage you to say, Kim, you're so off on this. This is how it really looks. And then when I have a chance to get these questions from you, we'll go back and redo this, okay? But what can I do to prevent this obstacle? I mean, that might look like maybe right after an afternoon nap when you're feeling a little bit more refreshed. That might be a time that you get to lean into some touch or connection with a partner. It might be right after a shower. Maybe there's something about a shower that kind of energizes you or wakes you up. Or it might be before taking medications that have an impact of causing more fatigue. Maybe we try to build in some touch right before that. Right. So we have to be creative and really think of your own unique situations. I always think about sexuality like a thumbprint. It's very unique for all of us. So I'm just throwing some ideas out there to hopefully get your brains going in this direction. Okay. And then oh, go ahead.
I'll just add a little feature with the ALS. If the fatigue, which normally is coming from the breathing difficulty or the weaker respiratory muscles, okay. Sometimes if they take a nap or before they want to be intimate, are able to take a rest with their non-invasive ventilation, they will find that will help them recover some energy.
Okay, yeah, perfect. I love that, Sherry. So yeah, your brain's going with me right here. So yeah, so maybe something like taking that rest with your breathing apparatus and really letting that oxygen flow through your body will give you just a little bit of bump in energy, just enough to lean into that intimate touch and that connection. So very good. And then this next question I really like too, psychologically, it is a really powerful way to think about things. So it says, what specifically will I do to get back to this goal, this goal of intimate connection, this goal of eroticism, when the obstacle happens? So what that looks like, when I usually use this question would be something like, if I have somebody who, let's say, I work really closely with pelvic floor physical therapists, and so they are working with people who have spastic muscles around their pelvic floor area. So let's say we've really worked on like preventing pain, the pelvic pain, and then doggone it, they thought they did all the prep work to make sure that didn't happen. They figured out when it was going to occur and how to prevent it, and then they started having sex and it happened anyway. So a lot of times what couples will do is they'll get frustrated and mad, and somebody gets sad and they go to sleep then crying, or somebody storms out. It just does not connect us to our goal of intimacy and connection. So if we can have this mindset of, boy, if we're headed in the right direction, then something goes off the rails. How are we going to get back there? If we use our example of fatigue, what that might look like is, boy, I thought we rested up. I thought we used our oxygen for a little bit. I thought we had that energy. And doggone if Sally didn't fall asleep in the middle of it. Like that can happen. But if we go back to that idea of our goal is connection, if we keep that in the forefront of our mind, then what do we do if Sally does fall asleep? Do we go ahead and hold her close and feel some skin on skin contact as she has a sweet little dream? Do we nudge her awake lovingly and say, let's try this again? Or there's no right or wrong answer. But again, just keeping in mind that we want the ending of that sexual encounter to be something that really is consistent with our goal. Okay. So again, if you have questions, I'm going to stop screen sharing this, but if you have questions, please don't hesitate. Okay. All right. So another thing that I do often with my couples who have been hit with some really big medical diagnoses, with changing bodies, maybe trust in our body has shifted, side effects, symptoms of medications and things are big. One of the questions that I really love people to start to ask is, what pleasure am I capable of now? Okay. Sometimes what I see in my office is that people have a really rigid way in which they are defining sexuality. And it includes certain positions, that includes certain erections and this and that. It just includes like a really small story or a narrative around what touch and intimacy and connection can be. And if we do that, and our bodies are not the same, and our dynamics in our partnerships are not the same, and all of that is changed, boy, it becomes really easy to feel like we must be on the sidelines now of sexuality. Like we're not going to get to play in that playground anymore. So I really invite you to start to change that narrative. What's interesting, if we think about how our brain works, they've done these cool brain studies that show us if somebody is holding your hand on the couch and rubbing your hand or having intercourse with you, the same parts of our brain are lit up. When somebody hugs you and holds you and you have skin on skin contact, the same parts of your brain light up versus thrusting intercourse and all that jazz. So that question, what pleasure am I capable of now? And this is a question, I'm remarried at this point, and this is a question I've been asking. My husband has an injury right now. I had shoulder surgery. So that's the question I'm asking in my house. He's like, oh man, my shoulder hurts. And great, how can I massage that for you? And then I say, and what other pleasure are you capable of now? Do you want me to kiss you lovingly and longly? Do you want me to give you a like, hello, morning kiss? Or do you want me to really kiss you today? Are there other parts of your body that are not in pain right now that I can just, lovingly touch and explore and that kind of thing, right? So what pleasure am I capable of now? It may mean that you together in the shower and you're having a bathing experience, but this time you do it as a team, both unclothed. Maybe the pleasure you're capable of now is being able to see each other's bodies. Maybe the pleasure you're capable of now is being able to lie in the bed, just spooning intimately. Maybe, I could go on and on with examples of this. Hopefully I'm getting your brains going in your own direction with something that feels congruent with your thumbprint and not mine, right? But I hope this is resonating. Sherry, yeah?
Yeah, we have a very timely kind of comment that kind of goes with what you're talking about in a question.
Right.
And this gentleman says, I feel really terrible and guilty about this, but with my wife's condition, I'm not sexually attracted to her as in the past. Would like to know the physical, mental benefits to my wife to become intimate.
Oh, great. Yeah. So there are a lot of benefits to physical intimacy. Even things like there's some really interesting research about reduction in pain. So we see that anywhere from 3 hours to up to 3 days, people will say that their pain has been reduced post-orgasm. Now that orgasm, again, may not be reached the way that it used to be reached. Maybe there are different aids, maybe there are different tools, different things that we could use to stimulate differently. They can help reach that orgasm, but for sure, we know that it boosts your immune system when you are experiencing touch. If you look at, and maybe I would encourage you all to do this, like look up what the brain looks like with a functional MRI when there's an orgasm happening, the entire brain lights up and get activated really well. So it is influencing all parts of ourself when we're able to have that kind of physical touch and intimacy.
We have another comment that says, I was going through a divorce when I found out that I have ALS. If I start to connect with someone new, should I tell them in the beginning?
Yeah, that one is an interesting one to navigate. I don't really have a hard or fast way to navigate that. I think it's very situation dependent. Like if you started to date somebody new and you felt a really deep connection with them, is that going to make it safer to tell them or not? If you just want to have a physical connection with them and you're not interested in more than that, I don't know. I don't know what your values are. You do you. I have no judgment. You do you. Okay. But I'm saying there are a lot of different variables that may influence whether you opt to tell or if you don't tell from the beginning. I'm happy if you run into a scenario in the future. If you ever wanted to email me or my business number is textable, I'm happy to talk through that with you too as it arises. But yeah, are there other questions, Sherry, that are starting to pop up or comments or?
I don't have any new ones at this point, but I like what you're talking about, that, it doesn't have to be intercourse, that there's so many ways that connection, that physical connection is important.
Mm-hmm. And sometimes with changing bodies, we do need to use different aids, different sexual aids. So what that might look like is something like, let's say you've never used a vibrator in a partnered way. That might be something that we have to lean into at this point because of what we're, another thing that comes to mind is there are these wedges, like sexual pillows that are wedges that can help with positioning of a partner. So we can get a partner into a position and then be able to have intercourse. There are gliders, these little, they almost look like the ottoman of a, those gliding rocking chairs. So they look like the ottoman part that somebody whose body isn't able to have the strength that used to have to be able to be on top or something. Somebody can sit in that glider and the different positions become accessible and they don't have to do a lot of work with their body to have that same kind of movement. There are also things like little straps that you could use to do things like strap your legs into place and hold them during sexual touch. There's quite a bit. And actually, for whatever reason, that also made me think of other benefits that we see with physical touch. So they've had some studies where they've actually had people who are becoming arthritic do things like massaging their partner's body parts to help with the fluidity in their hands. And it actually protected them from the stiffness of arthritis. So I'm going to guess, again, I haven't seen that specific to ALS, but I'm going to guess we may see some of those same kind of physical benefits there too. Yeah.
I got another question in my email, Kim, and it was talking about, with ALS, as it advances, the individual is likely to have a feeding tube. They're dealing with their breathing machine, wheelchairs, other kinds of suction machines. How do you deal with all of that? I mean, not all of it has to be on and active in the moments, but how do you navigate around all that equipment?
Yeah, so it kind of depends on the equipment. I mean, interestingly enough, for a lot of different bags, like ileostomy bags, colostomy bags, things like that, there are actually like little lingerie type lace covers for that can help people feel a little bit more like, I don't know, sexy time, I suppose. If we need a breathing apparatus, if you can take a small break from that, you might. If you cannot take a small break from that, then we kiss around that, we touch around that, we find the parts of the body that still feel good to be caressed. Another thing that a lot of times I'll do with folks when their body has betrayed them, when their body is not cooperating with them any longer, it can be really scary for them to be in their own body because their body is working against them. And it can be also, we have to acknowledge it can be terrifying for their partner to be touching their body and navigating their body because they don't want to hurt them. They don't want to make their breathing more difficult. They don't want to tax them. They don't want to fatigue them more. They don't want to do all those things. So what I'd like to have couples do, if they're open to it, is to actually do non-erotic touch so they can practice actually seeing what sensations do feel good. You know, when our body's a scary place to be, we kind of shut the whole thing off. But we can do non-erotic touch so that our partners feel confident touching again. And so we remember that there are parts of our body that really are soothed by or excited by touch. So non-erotic touch, what I mean when I say that, it may be something like you're going to give a scalp massage to somebody and just let them have that sensory experience and let them be welcome in their own body again. And you get to confidently touch them in a way that you see as pleasing. If it's possible to give feedback, oral feedback, if we don't have a breathing apparatus in at that moment, to be able to say, oh, I like that touch. Can you touch me more in this spot? I think I'd like you to move from my head to my shoulders now. Things like that. So then a partner doesn't have to guess, like, how should I be touching this person right now that I love so much? But instead, they're getting those instructions. And again, that can bring the person who has the diagnosis back into their body. So their body is not just a scary place to be. It can be really comforting and lovely place to be. So a scalp massage would be one example of that. A hand massage, someplace that people sometimes start with that. Shoulder massage, foot massage, just whatever feels really organic or right to you. If you take a moment to think, where do I want to be touched in this moment? That doesn't feel scary or overwhelming. Sometimes going right to erotic touch can feel like, whoa, wait, hold on there, buddy. I'm not quite ready for that. For both partners, not just the person who has ALS, but both partners may have that experience. I can for sure remember that with my husband when he was going through cancer treatment, just not wanting to, he had a lot of joint aches and pains and fatigue and things from his interferon. And I did not want to touch him in a way that was going to overwhelm him or he felt a lot of feelings of I'm feeling you, Kim. He would say that to me often, like, I was the one who's supposed to protect you. And I feel like I'm failing you. So I never wanted to like invite him to do something that was going to then make him feel like he was failing me sexually too. So we had to do a lot of this navigating of what pleasure are we capable of now and how can we both learn how to be confident with touch again that feels safe, that keeps both of us in our body and both of us in that connection. Questions?
Yeah, another thing with ALS that is sometimes one of the early things, if it starts in the bulbar region, is the speech becomes a problem. Or as people advance, they could have no voice and may also not have the use of their arms and their hands. So even outside of the actual moments, communication is difficult. And you know, I hear you talking a lot about the importance of communicating or during, after the whole thing. So any suggestions to help people where that communication is not fluid, normal?
Yeah, it's not easy to access. Yes, so sometimes communication is, in fact, there's a great researcher out of Canada. Her name is Peggy Kleinplatz, and she talks about becoming an empathic lover. But what that means is actually really staying in tune with your partner's nonverbal cues. So let's say I was giving my partner a hand massage. And as I gave them a hand massage, their hand just kind of curled up and became all soft and gooey. That would be a great indication to me that I was touching them in a way that was really pleasing to them and was really relaxing them. I was giving my partner a hand massage and I saw them instead start to stiffen up, I'm like, ah, right. That's a great indication to me that they want to be touched in a very different way. You may notice as you give somebody a scalp massage, if they're kind of trying to lean away from you, there's your indication that that might not be how they're really longing to be touched in that moment. If you see them soften, there's your indication that they're right there with you and they're so pleased by that touch. So it's a lot of the nonverbals. If you rub their shoulder and you feel it tighten up or you feel it twitch or move, you might have hit a tender spot. So you can check in, right? Oh, did I hit a tender spot? Sorry, babe. Like, what if I'm moving up here? Oh, I see you're not twitching or pulling away there. So let's stay in that spot for you instead. So that would be an example of what we might do. And still, it is lovely and important, beautiful communication. It just may be coming in the form of not verbal communication. It's coming in this other way. So we always want to be looking at, paying attention, be tuned into our partner's bodies and what their bodies are telling us.
Great, thanks, Kim.
Yeah. Was there another question or we're going to keep rolling?
Go ahead and keep going.
Okay, so I've mentioned this a little bit, but that idea of being able to change our sexual narrative becomes a really important part of recovery. So changing our sex, that's really cognitive behavior therapy in the world of a psychologist. It's like, how can we think about sexuality differently so that it really serves us well and becomes a protective factor for us? So it does things like boost our immune system and lets us feel some level of normalcy or some level of pleasure. The idea that you have ALS and that makes you incapable of pleasure feels like a false narrative. There is some place in our body, in our being, that we may actually be able to access pleasure. Whether, again, it's a ear rub, whether it's a kiss on the neck, whether I did a presentation in Omaha at Quality Life Institute. So they work with spinal cord injuries. And I remember one of the physical therapists saying, okay, I hear what you're saying, Kim, but I've got people who have upper cervical injuries. They can't move their arms, they can't move their legs. So with the exception of them, she said, with the exception of them, what can we do around sexuality? And I said, slow your roll, sister. Like somebody who from the neck below has no adaptive functioning, that does not mean that they are asexual beings. So we came up with a whole list of activities they may be able to engage in that made them an erotic partner to their wife. I happened to be a male person that she was presenting. And it was things like he still had sensation in his mouth. So would it feel like for him to really engage in kissing or being caressed or touched on his face? He still had eyes. Were there ways that his wife or partner could put on lingerie and dance around the room or do something along those lines? He could still read. So could they, as an intimate couple, read erotica? And I like to say, if there is something that you do not do with the Walmart checkout guy, we can count that as erotic, So reading stories together that were a little saucier, little romance novels, we all have those from the grocery store, ladies, you know what I'm talking about, But doing that in a partnered way, then all of a sudden we're inviting that energy to come back into our lives again, right? So it did not matter that he was incapable of moving from his neck down. He still had access to pleasure and erotic energy. We just have to change the script. Right? We have to be willing and brave enough. And I do think it takes bravery and courage to change our scripts at times. Right? We've all been handed a narrative around this is what sex is supposed to look like. So when we start to invite ourselves or our partners to change that, that comes from a place of courage to do that. And also can be really lovely and rewarding when we're able to get there. So, okay, I feel like I've talked at you a whole bunch. So I really wanted to, I think we got about 15 or 20 minutes left. Let's really take some time. it truly is my goal to make sure that your questions are honestly addressed and answered. So if we can make this a Q&A session for the remainder of our time together, be really lovely.
That would be great. And if you guys can just send them either to the chat or the email, that'd be best, because I'd like to keep recording this and I don't want to capture anyone on the screen. But we do have a comment that we can start with. It says, to my knowledge, ALS does not affect the sense of touch, smell, or sight. And that is correct. It does not affect those things. So
And if we think about how touch, sight, smell can all be pathways to erotic energy, like absolutely, we all have seen something like Ryan Gosling. We've seen something like that that makes us say, old Chris Hemsworth, Travis Kelce, something, right? And there's been something that we see that gets like, oh, I still, within the last week, I walked by somebody in the store who had on the same cologne that my husband who passed away used to wear. Instantly, that woke me right up, right? Smell is absolutely part of that. So hearing, there are things that are muttered in my ear with my current husband that make me feel, so yeah, those are great things to lean into, all those sensory experiences.
right. I think another question that I've seen is just the difficulty. You addressed this a little bit, I think mostly in the beginning, but how do you separate that role when you, especially as things progress and you are really a full-time caregiver for your partner, and separating yourself from that role of a caregiver, which is a very different role than you have with a sexual partner?
Yeah, I do think it has to be very intentional because, like I said, when we are in that caregiver role, it's almost like a parent-child role. And our brain is luckily designed to say that we should not access our sexuality with children, right? So, like within my own relationship with my husband, as he was progressing in his illness, I really thought very actively about how protective it was for him and his well-being for me to be touching him. So it was common. So from January 3rd until March 6th, he was either in the hospital or he never came home. He was in the hospital, rehab, or hospice care. The number of times I clicked the little nurse button and I'd say, can you all help move him over a little bit? Because I want to get into bed with him and I want to hold him. That happened often. And I would hold him and I would caress his arm, I would caress his face. And when they walked out, I would caress other parts. So he just remembered that he was my man. He was my man. I was his lover. I was his partner. But it had to be a thoughtful thing. It would have been very easy for me to be wrapped up in how am I navigating my 7-year-old, my 10-year-old, or watching their dad die and all that kind of stuff. And how do I become a widow at 43? And what the heck is that going to look like? But I just knew it would protect him. So that's where my mind went with it. You may be different in your relationship dynamics, and there might be a different thing that would motivate you. But I also knew it was protective for me. To this day, if I want to feel safe, I close my eyes and imagine having my head on that man's chest. So in the middle of all of that chaos of his dying process, me climbing into bed with him to attend to him was also me feeling like I was in the safest place I could be in those moments, which was beautiful. I loved it. The number of times doctors would walk into the room and see me snuggling my husband and then say, oh, whoa, I didn't know what to do. I don't know if I've seen that before. That kind of goop. Like you haven't seen somebody cuddle before. I don't know where you've been. But just be ready if you happen to do that in a care facility, they're gonna like have a weird reaction to it. But I say poo to them, take care of yourselves and get some touch.
So don't let their discomfort become your discomfort.
No way.
Wonderful. Erin, have you gotten any questions?
I haven't had to become thorough.
Okay. Okay. So let me see. I'm trying to think if there's other things. I really think you've addressed a lot of the things that I've seen come through or that we've thought about. So I just encourage if anybody else, we still have a little bit of time, and if you've got some kind of question, please send it through so we can talk about it with Kim, get her expertise while she's here. I know one other thought I had as you were talking about it, and I'll let everyone on the call know that, we did record this, so I'm happy to send this out. And I always send a follow-up email, so I will include the information about that worksheet that Kim shared and some of Kim's information. Kim, do you want to talk a little bit about what you were telling me before we started about a telehealth availability too for people?
Yes, we happen to be living in a post-COVID era. The one big benefit that we got from that is for psychologists, you can access across state lines care, like telehealth care. So as a sex therapist, there are now, I think, 39 or 40 states who have agreed to participate in this thing called PsyPact, which means they're a certifying body that will pay attention to if you're licensed and if you're a really good human in the world of psychology. And then they will let you practice across your state lines. So sex therapy is the most accessible in the nation that it has ever been. There are not that many sex therapists in this nation, but it is now accessible. So not that you would have to see me, there are sex therapists all over the nation that are PsyPact certified now. So if you live in one of the states that has agreed to be part of this legislation, now, like I said, there are 39 or 40 that are now participating. You could see a therapist in New York City or, in Florida or in California, in Texas and Arizona, all different places. So don't feel like you're isolated. There really are ways to access and reach the support that you want. Every website you will ever look at related to sexual health will tell you on that website, if you're having these symptoms or concerns, talk to your healthcare provider. I can tell you for sure, your healthcare providers are not going to have this conversation with you. I tried when Mark was going through his situation, and the way that played out was I had one doctor on that little round rolly chair in their office slide all the way back to the corner and literally put his hands on the wall when I asked him about the sexual side effects of Mark's chemotherapy. He could not even have the conversation. Mark and I happened to be in the process of trying to get pregnant with our second child when he was diagnosed. And so when I asked about how is this going to impact his sexual functioning, because we knew whether Mark lived or died, we wanted to make sure our son Rhett had a sibling to share his life with, whatever that life was. That provider told me that Mark's sexuality was a variable he could not be concerned with. So they abandoned us as quickly as they possibly could because of their own discomfort around sexuality. And we had to do our own digging and our own sorting through and figuring it out all by ourselves. And luckily I am who I am, so I was willing and able to do that. But a lot of people don't know where to turn or where to find the information. So I would encourage you to look for someone who's trained like a sex therapist if you have those questions, and lean into that person because they're going to hold space for you really well.
Wonderful. You had also mentioned during your presentation about different sex tools and things that can help in AIDS. Is that something else I can get from you to include in the email, or can you talk a little bit about where they would find those things and understand what to do with some of those things?
Yeah, something like a Google search is really lovely for things like this. But again, when I think about something like ALS or MS or some of those neurological things, I think about the one first thing that comes to mind is like a sex pillow that is a wedge, because then you are able to like lay over it or use it as a backdrop. So it's just not all squishy and awkward and that kind of thing. Depending upon neurological functioning, sometimes we have to change the kind of sensation that will allow us to reach things like orgasm. So sometimes we have to change our tools and our toys and our aids in that way. Those are probably the two things that, and then like I said, that glider. So that little glider is such an effortless way to be able to move the body. So we still get the motion of thrusting if that is wanted, with very little physical effort. So that can help if you're fatigued or if there's limitations. But those are all things that we would do a Google search for and they would come up.
Okay. We do have another question. It says, are there any books that can guide us? I haven't found or don't know the questions to ask, or specific authors or studies that would help.
Yeah, so there right away, the one that comes to mind, let me make sure I'm getting his name. There is a sex therapist who's he is a great guy, really competent, and also in a wheelchair. So I'm trying to remember if it was spinal cord injury or if it was an illness process, and I'm not quite sure. And I think I know it's Mitch is his first name. I think Tipper is his last name, but let me double check that for us. And I might have to get back to you on this one. I don't want to take a lot of time with this, but there is a sex therapist who's written a book about accessing sexuality with bodies that don't feel typical any longer. So he would be a great one for us to look at. And it did come up instantly when I searched it. It's Mitch. I know him by first name. I'll figure out his last name and get it to you.
Okay, that'd be great. If you can get that to me, I'll include it in the email for everyone.
Mm-hmm.
Okay, oops, here, maybe one more new message here. Okay, ALS patients and caregivers become pretty good problem solvers as they face new aspects of ALS monthly, which is often how things are changing. I really appreciate this session. Thank you. Identification of tools would be a great reference, and your book sounds great. So we'll make sure that we get those. I'll get those things from Kim so that they can be in the follow-up email for you guys to do some more research and things.
Yeah, the other thing that we can find pretty easily online are changes on positions that are way less taxing on the body. So I would also encourage you to look that up. And it may be things like side by side. If you look up, if you just look up great positions for sex when there is muscle weakness, or a lot of my clients will find good resources if they look up things like back pain, because a lot of how many Americans have back pain and have had to be adaptive around their positioning, but then those positions will also work if there's muscle weakness or muscle spasms and things like that.
Okay, wonderful. Do we have any last questions before we wrap things up? I'm not seeing anything else. Aaron, pop in if you have any. Otherwise, Kim, I think this was wonderful. I hope people that joined us got some good information that can help them with that, such an important connection. And, you know, we are all about living with ALS, and this is an important piece about living with ALS. So, so much. I'll get those final tools from you and resources and share them.
Yeah, and again, I want to just thank you all for your courage to join me today. I know it doesn't feel easy to come and talk about sexuality and erotic stuff, but you did it and you let me be a part of it, which is absolutely amazing. I really feel touched and honored that you invited me into this today.
Great. We're getting
Thanks.